My name's John Dankosky. I host a podcast called Steady Habits for the Connecticut Mirror, which you can find anywhere you get your podcasts, as they say. We're actually going to be dropping a version of this conversation in our podcast feed tomorrow morning so that you can listen to it in a slightly different form than here on Zoom. I've been going around asking our panelists what they had for lunch today, that sort of thing. It's what we always do in radio shows to try to make sure that everyone sounds okay. But now that we've mic checked and done all of that stuff, and we've gotten a few folks loaded in. Look at that, already 159 participants. That's pretty good. And we'll get more loading in throughout the course of this evening. Our special sponsors for this event are the good folks at CBIA. We really want to thank them for doing their part. And if we can, let's start with a paid sponsorship message from CBIA.
Rebuilding Connecticut is a challenge unlike any we've ever faced. Tax hikes and unchecked government spending will hurt our recovery. They won't make the state more affordable, bring back jobs, or attract new businesses. We can rebuild our economy and get people back to work. But that means taking a different approach, working together to unlock opportunities and the state's tremendous potential. Find out which leaders stand with you and your local small businesses at RebuildCT.com.
Rebuilding Connecticut following the COVID pandemic is a challenge unlike any we've ever faced before. State tax hikes and unchecked government spending have proven to impede our recovery. They don't make our state more affordable. They chase away our businesses, good-paying jobs, and our people. The good news is we can rebuild our economy and get our people back to work. But it's going to take a different approach and different thinking. Our businesses were essential when our communities needed them most. And now it's our turn. Every business, worker, friend, neighbor is essential to recovering our economy better, stronger, and more prosperous than before. Ask your local leaders to stand with you and your local businesses. Sign the Rebuild Connecticut pledge at RebuildCT.com.
Before we start, I also want to thank all of our members, people who have supported the Connecticut Mirror in the past or are supporting us right now. If you haven't yet become a supporter, you can go to ctmirror.org and just click on that little donate button. It's a good time anytime to support nonprofit journalism. Let me welcome in our panelists who are going to help us walk through some of the things we can look for this legislative session, but also some of the big challenges facing the state at this moment. Mark Pazniokas is the Capitol Bureau Chief of the Connecticut Mirror. Welcome to our program, Paz.
Good evening.
Jenna Carlesso is the Connecticut Mirror's health reporter. Jenna, good to see you. Thanks so much for being here. And thanks also to Kasturi Pananjady, who's our data journalist. Kasturi, thanks for being here as well.
Hello, thanks for having me.
If you would like to submit any questions for our panel, you can use that Q&A function that's at the bottom of the screen there. It's very simple. Just type in your question. I will get to as many of them as we can. We've got a couple hundred people on the line, so we might have a lot of questions to get to in the second half of our program. We'll see what we can do to get to some of them. Paz, I'm going to start with you. And I think it's important to just set a scene here for people who maybe are used to a Connecticut legislative session that looks a certain way. It is not going to look anything like that when the session gets started.
No, it's not. And starting tomorrow morning, we're going to have the extraordinary sight of the House and Senate convening outside. The Senate will be in the parking lot between the Capitol and the LOB. If anybody was planning on parking there, you might want to make other plans. And the House will be on the north side. This is all, of course, done out of concern about COVID-19, which cut short the 2020 session and is really hanging over this session going in, both as far as some of the substance and the challenge of things facing the General Assembly, as well as how exactly the place is going to work. So it's going to be a hybrid. You will have, when they are ready to debate a bill in the chambers, you will have people in the building. But when it comes to committee work, public hearings, this is going to be done virtually. This is going to be a challenge for the public. It's going to be a challenge for lobbyists. It's going to be a challenge for all of us. There's really no book on this. We had very short experience last year, kind of 2 dress rehearsals with the 2 special sessions that were very brief. But there's no question this is going to be a challenge.
When you talk about a challenge for just the public having access, this is a really important thing, and it's not to be taken lightly. Is there going to be a sense that most of the work that is usually done during a legislative session is going to get done, but in a different form? Or are we just going to see a lot less work getting done, fewer meetings, fewer public hearings?
I'll quote Matt Ritter, who's going to become the House Speaker tomorrow, and he said the limits of COVID don't mean that the legislature can't tackle big and complicated things, but it does mean there won't be as many of them. There's a limit on bandwidth when you are doing things virtually. And we use bandwidth kind of as a figurative term, but there's sort of there's a literal aspect to that as well. And when everything is going to be done virtually, it becomes very cumbersome, and that will be a factor. They have agreed on rules that are intended to move the legislature from its, even in this age, still a reliance on paper. Bills are filed on paper. They are moved from chamber to chamber when they're acted on. It's a real old school thing. And Marty Looney, the Senate president, said, the staff has worked very hard to move the legislature very quickly from a quill pen to a computer. And that's kind of what they've tried to do. But it's going to be harder and harder to do a lot of complicated things. You will lose all the important casual conversations that take place between lawmakers in the chamber, in committee hearing rooms, in the corridors, over coffee in the LLB. It's the opportunity for the public, for lobbyists and reporters to see who is in a certain committee room, what they're interested in, to pick up intel about what are the arguments that are bubbling up against or for something. There is just a lot of informal exchanges of information that go on at the state capitol, and that cannot be replicated online very easily.
And Jenna, I want to go to you because I want to talk to you in just a moment about some of the really substantive issues that you're going to be covering during this legislative session. But many of those substantive issues really do carry a lot of passionate debate. There are a lot of people who have joined in rallies at the Capitol around them, who join in public hearings. And as Paz is saying, this is going to change the business of how these very important votes are decided, how these very important issues are being argued.
Yeah, I think, certainly for folks, it could be a problem for folks if you don't have a computer or a phone. But on the other hand, for the people who, like last year, we saw for the bill that would remove the religious exemption from mandatory vaccinations, there was a very long public hearing on that. And, if you are unable, to take a day off work to go in to the Capitol to testify, now you can testify on your computer.
And we'll be talking about that issue and a couple others. Maybe before we go into some more of the politics, Paz, I want to get to, and some of the big issues that lawmakers are going to be grappling with. Kasturi, I want to go to you, and maybe we can get an overview of where exactly the state stands right now when it comes to COVID, because all of these things that we're talking about, everything that's going to happen with lawmakers really does have this overlay of we're still in the middle of a pandemic. It's changing the way that people are doing their work at the Capitol, but it's changing the lives of so many in the state. You've been tracking COVID numbers, everything from hospitalizations to infection rates to how quickly people are getting vaccinated. What are some of the things that you're seeing right now in terms of trends of COVID in the state that you're really going to be watching for?
Yeah, I think it's a good question. I think we're very much in the second wave. We don't necessarily know that we've peaked in terms of hospitalizations to start with. I think the situation just in general is just very tenuous. I think that one of the two things that I spend a lot of time looking at are hospitalizations and also now the vaccine effort, to try and get a sense of how quickly the state's distributing vaccines, who it's distributing it to, and what that will mean for its ability to sort of open up again. So yeah, I think that we are in a second wave. We are seeing a slight downward trend in hospitalizations right now, which is very interesting, even though cases are still pretty high. No one really understands why that is, but I think we're still waiting to see what the effects of the holiday are, what that means for hospital capacity, what that means for reopening in general.
When you see that rolling average, that average that comes out every couple of days, that can get big headlines. It spikes to 9% and people get worried, but the hospitalizations go down. Kasturi, as a data person, what numbers do you watch that you think make the most sense for people to pay attention to?
Yeah, I think that just in general, focus on daily numbers perhaps is not the best way to think about any of these things. You want the 7-day rolling average. If you're trying to make any sort of conclusions about events and their effect on COVID spread, for instance, the holidays, you don't necessarily want to be going off the numbers that come out of the briefings, because the governor reports tests based on the day that a test result comes back from a lab. There's a separate data set that's hosted by the government on CD Open Data that actually shows you testing data based on the day that a specimen was collected. So that's a little bit more useful if you're trying to do that kind of analysis, but at the same time, there's only so much a layperson can do. Yeah, I think that I would just be careful about coming to any conclusions without looking at a 7-day rolling average, and be particularly careful about drawing causal relationships between events and COVID spread.
Paz, one of the things that we've noted throughout the course of this year, of course, is the governor has had these expanded emergency powers because the legislature hasn't been in session. The governor's really been communicating almost everything having to do with COVID. Do you think any of that changes in terms of the way that other lawmakers in the state get involved? Do we start to see different sorts of messaging now that the session is about to get underway and other people are probably going to have some perhaps slightly different ideas about how to report information, what to do with that information, and really how well we're doing as far as things like vaccination?
Well, the question of the legislature ceding to the governor these extraordinary powers becomes more complicated when they are in session. It is hard for legislators to say that we are not in a position to participate in the governance of Connecticut during this pandemic. And so that's sort of the abstract idea that I think everybody can quickly get. Yeah, they're in session, they're there. They should be helping making some of these decisions. Okay, we get that. Now you get the practicalities as to who wants to own the decision of whether or not your child is going to school, of whether or not your business can be open for 50%, for 75%, whether you have to invest in more plexiglass shields between tables, whether you have to move manufacturing machinery to provide social distancing. So that's the struggle here. I don't think there's any disagreement that the General Assembly needs, again, to take some ownership here. So the governor's emergency, that it's the second of the 2 6-month emergencies, expires February 9th. That was very deliberate, that they wanted the legislature in for a month to kind of see what things look like, to give them a little time to then say, okay, what do we do on February 9th? Nobody really expects the world's going to go back to what it was in February of 2020. But the question is now, what will be on the governor, what will be solely in the control of the governor, and what will the General Assembly now be involved in? And we had a little preview of that really off stage, the private talks that the legislative leaders had about their own rules for how to handle this session. And there was some back and forth on that. It's been pretty much resolved, although one of the 4 caucus leaders, Senate Republican leader Kevin Kelly, is not, as he described to me tonight, not on the same page with the other 3 caucus leaders. He still has concerns about the lack of public access to the building and to the process, but I've not heard him really spell out alternatives, how you safely make that happen. One of the interesting things about our governor is I think, certainly the polls would bear me out that his first year in governor was really considered a failure. It all built around one big idea that we are going to dramatically increase funding for transportation. We are going to do so by returning to highway tolls. And he failed. He failed miserably, even with smaller packages. It was a great embarrassment for him. It really colored his first year, and the polls showed that. He was among the least popular governors in the United States at the end of 2019. Then the pandemic hits in March of last year. The General Assembly literally leaves town. I mean, they close down the session, and now the governor is free to govern as he sees fit. He has not shown a great skill set on putting forward a legislative package and getting it passed. But he generally gets high marks, and good polling results about his handling of the pandemic. And so now we are in a third phase. Again, where it's, in the schools, we talk about the hybrid of virtual and in person. Well, now we have a hybrid year, and this is a challenge for the governor as well. So the question is, what will he propose in his State of the State tomorrow? Will there be specific proposals as opposed to sort of setting a tone? He has some things on the table in front of him, and it's unclear as to what he will push and his ability to get something passed in the General Assembly. So it really is, this is kind of if this is a 3-act play, we're now starting the 3rd act, and we're going to see what plot twist unfold.
Yeah, and a few other things maybe, Paz, throughout the course of the hour that we can talk about are some of the issues surrounding that new leadership in the House and Senate, and also the fact that this seems to be kicking off a new gubernatorial election cycle as well, which is a whole nother political issue. Before we get too far away, though, from some of the things that you've been working on, Kasturi, and I want to bring in Jenna as well in a second, but let's talk about how the state is actually doing as far as vaccinating people right now. This is incredibly important because none of this stuff gets done if we can't actually get enough people vaccinated to go back to work, whether it's at our pizza shop or at the state legislature. So compared to other states, Kasturi, how is Connecticut doing as far as getting vaccinations out to people?
It's a good question. Again, something that Jenna and I briefly worked on a little bit on Monday, but feel free to jump in also, Jenna, as I talk about this. But Connecticut's actually doing pretty well with regard to distributing the vaccines, administering the vaccines that it has distributed. So I think it was 3rd in the state as of Monday. I think about 50% of vaccines that have been distributed have actually ended up in the arms of people. So
third in the nation.
Yeah, as of Monday night. I think that so I think broadly on that basis, Connecticut seems to be doing very well. I know that anecdotally, Jenna's also been hearing from sources that the vaccine rollout's been relatively smooth. Is that fair to say?
Yeah, as of Monday, it was close to 76,000 doses statewide. There's a little bit of a concern about nursing home workers' participation rate, and they've launched a campaign to try to get more folks in. But nursing home residents and hospital personnel, I'd say so, yeah.
I'm wondering, Jen, if we can stay with nursing homes because of all the things that happened during the course of this last year, not just in Connecticut, but across the nation, nursing homes have been hit incredibly hard. So among the things we're watching, how quickly can nursing home workers be vaccinated? But there are also questions that will come up during this legislative session around nursing home oversight, and lots of questions from nursing homes themselves about finding more funding to actually help them do what they need to do because they've taken such a hit. So maybe you can give us a little bit of a sense of what we should expect around nursing homes during this legislative session.
Yeah, that's a good question, because Lamont also can do a lot with his executive powers. But the nursing home working group that's been coming up with legislative ideas, there's staffing is a concern, so mandated staffing ratios perhaps, a minimum wage for direct care workers, some sort of state policy that gets at visitation to make sure it's equal across the board, and also the controversial issue of cameras in rooms in nursing homes.
And this idea of expanded funding for nursing homes, I know that the governor has extended some additional funding as you've been reporting, but they're looking for a hell of a lot more than that.
Yeah, earlier in the year there was a request for, if I'm remembering right, and someone else jump in if I got this wrong, I think it was just over 300 million for to help with care. So they got some, but they didn't quite get what they were asking for.
Paz, how much do you see this being an issue that is going to be front and center for people? And I guess in a bigger sense, how much is this legislative session, in your mind, going to be taken over by issues having to do with dealing with COVID in nursing homes, in hospitals, everywhere, as opposed to some of the things that lawmakers might generally just bring to the table in any other given year?
It's an interesting question, because as they struggle directly with COVID, how can they operate? They are dealing with the issues that COVID has exposed in Connecticut. So, I mean, I like to look at this as this has been one giant stress test for what works and what doesn't work in Connecticut government. What are the weak points in Connecticut economy, the workforce? I mean, this has brought all kinds of issues to the fore. The reimbursement rates for nursing homes, what that allows them to pay these very essential workers who in many cases are getting a little bit more than minimum wage, or at least where minimum wage is going to be in a couple of years. It's raised all kinds of questions about the availability and affordability of daycare. What people can make providing daycare, what parents will pay. All of this stuff has bubbled up quickly. Now, unfortunately, it's come at a time when there are the same pandemic that raises these issues and exposes them. It complicates the ability of the General Assembly to deal with them. Because some of these things, it's, you're talking about a lot of money, right? You're talking about how much more money can be provided for these areas. We see projections of deficits, because Connecticut has a decent rainy day fund and the stock market still seems to be chugging along. It may not be a crisis this year, but certainly in the out years, this is a state that is still facing deep economic problems. Connecticut, at the start of the pandemic, had a very tight labor market. It was 3.6, 3.7% unemployment rate. And that was a huge opportunity. And this was one of the things that Governor Lamont was trying to work on a year ago. He rebranded the Governor's Workforce Council. He brought in a lot of new members. He's very big on networking, right? And having corporate leaders and others be involved with this. And the opportunity that people saw then was the labor market is so tight. There's now a business reason, a business rationale to work with government to bring in people into the workforce who are having trouble participating for all kinds of reasons. And of course, that went to hell very quickly, in the middle of March. So I'm sort of ducking you on the guts of your question, because I don't know. There are limits on time. There are limits on finances. Connecticut is still considered economically fragile. The private sector had recovered all of its jobs lost in the Great Recession, but Connecticut overall was still below where we were when the Great Recession started in 2008, 2009. There was a lot of public sector jobs that have been shed. There's some Indian casino jobs that are considered public sector. It's just the way that the feds do the numbers. But it's, Connecticut again has been in a bad place for a long time. And this governor has been very conscious of that, even when it comes to very selective tax changes of making it more progressive on the real high earners. There's a reluctance to do that. There's a reluctance to see a headline in the Wall Street Journal about Connecticut raising taxes. And there will be that tension in this session and over the next 2 years leading up to the next election as to what have we learned about what society owes these frontline workers, these essential workers, and how are we delivering on that? And that's a debate that's been on for a while and will get more and more intense.
There are a couple of questions actually coming in from our audience. From Barbara, what about contract workers in hospitals and nursing homes? Do they get on an approved list for vaccination, even if they're not directly employed by the institutions? Her second question is, will the COVID relief money for nursing homes go to actual patient care and not for raises for management? Oh, those are two good questions. Jenna, Kasturi, do you have any thoughts on either one of those? Maybe first answer the question about folks who work in hospitals and nursing homes getting on this list for vaccination.
So people who work in nursing homes they should be able to get vaccinated through their partnership with Walgreens and CVS, which are, I believe, going about 3 times. And they're somewhere, I think some homes are in round 1 still, and some are moving into round 2. For hospitals, it's also, you go through the hospital. Was there another provider that I missed?
No, I think that part of the question was if these folks are temporary workers, maybe not employed by the institutions, people who jump from job to job, which is, we've talked about this a lot. This is one of the issues that has really caused a lot of problems with COVID and in nursing homes. There's so many people who are working at 5 or 6 different facilities. So I think part of the question goes to, will people who aren't necessarily employed by any one institution, will they be able to get into the vaccination line?
I believe that is the case. If you're patient facing, if you're working with patients directly, you should be able to get vaccinated.
Yeah. And the second part of go ahead, Paz.
No, I was going to say, this is going to quickly get very complicated. The first phase, it was a fairly controlled environment, hospitals and nursing homes. And now as we go to the next group, it's a far more diverse group. They're in all kinds of places. And that will be really the test for how well Connecticut does in administering this. I don't mean to dismiss, how well they've done so far. But let's be honest. I mean, this was the easiest part of the rollout. It's going to quickly get very complicated.
So there's a lot more that I think we need to talk about that isn't necessarily COVID related, but has this aura of COVID about it. And maybe, Jenna, I'll go to you about a couple of the issues that we know are going to come up during this legislative session, including some that are very controversial. You mentioned this before, the religious exemption for vaccinations. In some ways, a conversation about vaccinations is incredibly important. I'm assuming that in some ways, this has changed over the course of this year. I could be wrong about this, but if we were having a really hot conversation about whether or not kids should be mandated to have vaccines a year ago before a pandemic, something about that conversation must have shifted. Am I wrong?
No, you're not wrong. If anything, folks I was talking to said COVID may complicate this, because even though the COVID vaccine is not on the state's list of mandatory vaccinations right now, it's a new vaccine. There's questions about it. And for folks that already were hesitant, this is creating, some more fear. And so, I think that's certainly going to be brought up this session and, in some ways could complicate the effort. Right now, it's not an issue, but in the future, could it be on the mandatory list? It could be.
So what is expected to happen during this legislative session, near as you can see it, around this religious exemption?
So I think there'll definitely be a bill again. Last year, they got it out of committee very quickly. It was supposed to be one of the first bills to go to the floor. COVID disrupted that. This year, they seem pretty resolute to do that again.
So the state of play when COVID hit and they shut down was, how can they compromise and how can they alter that? So one of the things that was an issue was, do you take a hard line against people who refuse to vaccinate their children? Or do you take a hard line against people who refuse to vaccinate their children and they are in schools or school systems that have fallen below what is generally considered to be herd immunity? And these were kind of the difficult issues, because the idea of throwing kids out of a public school, understandably, there's some reluctance in some quarters to do that. So one of the things that was going on when the pandemic hit was, is there a way to change the approach and perhaps become more selective? If you have school systems, again, or schools that have a 70% vaccination rate instead of a 94%. I mean, 95% is kind of the magic number, but do you want to start throwing kids out of school in a school that has a 94% vaccination rate or a 97%? And that was the discussion that was starting to unfold when they blew the whistle and exited the building.
Yeah, I think one thing you'll see this year is whether or not, last year's bill, there was a compromise. Children who were already in the school system could remain in the school system. That'll be a discussion point that's brought up again this year. And I think if you take that out of the equation, it'll be much more difficult to pass.
And some of this can be a conversation that I have next week with our education reporters, but so much has changed about education this year. The idea that kids had to go to school and be around other kids was just, obvious about a year and a half ago. And now we've gone through an entire year in which a whole bunch of people have, done online learning, and a lot of educators, including Miguel Cardona, the new Secretary of Education for the Biden administration, has told me we're probably never going back to a learning situation like the one that we used to have. So maybe some of these issues get slightly cleared up by the fact that not everyone's going to be in school together.
That's certainly a point that's been raised by one of the committee chairs. Yeah, on how has remote learning changed?
Because you're going to be tackling all of these incredibly hot button issues, Jenna, I'll go to you with another one, which is aid in dying legislation is another issue that has come up at the state capitol several times for years. Will there be any sort of bill this legislative session? And maybe you can just give our viewers here a little bit of an idea of what that debate is about.
Yeah, it sounds like that will be the case this year. As Paz mentioned, there is going to be some limit to what, they won't be running as many bills this year. So they will have to prioritize. But this was a plan, I believe the last version would have allowed doctors to prescribe a lethal dose of medication, excuse me, to people who are terminally ill. I think the last draft, it was 6 months or less to live. And the patients would have to submit 2 written requests for that lethal dose. And there were all kinds of explainers and counseling and other things wrapped into that. It is really controversial. It's never made it out of committee in Connecticut. And even though we have a new legislature this year, it's still going to be controversial.
I don't know, I can't recall what committee it started in last time, but I do know that the new speaker has changed the membership of the Public Health Committee, and it's a far more friendly place regarding vaccines. A couple of very prominent vaccine skeptics are off the committee. But that's one of the things you have to look at, to the extent to which committees have changed, what the new members will mean. There are 21 new House members, 3 new senators. And I don't know that, aid and dying is something that people were asked about when they were door knocking, running for their first term. So these are the things that it takes some time to sort out. But it's the people, the people allied against aid and dying. It's an interesting group because it's really not liberal or conservative so much as people with disabilities, people who have fought to have their voices heard, people who tend to be marginalized. These are the folks who are most skeptical about aid and dying. And the folks who have always felt in control of their lives are the ones who are adamant that they want the ability to control the end of their life. So it really is, for reporters, it's a fascinating issue to see how it breaks down and what really motivates people. It is a very different issue in that regard.
As one of our attendees, though, just said, what's the possibility of getting anything remotely controversial through in a session when our only access to legislators is going to be remote? Are we going to have the stomach to do this? I asked some version of this question before, Paz, but this looks like a perfect example of something that people might not want to touch during a session that is just so very weird that we might want to park this and come back to it at some later time.
Yeah, I'll go back to, the word bandwidth. This is where figuratively there's a limit to what these folks can handle in a 5-month session. You have people coming at you with, the governor insists he's going to put forward a bill that outlines his approach to online gambling. This is a very difficult thing. This isn't just legalizing sports betting, which I think is a relatively easy issue for this General Assembly. But the idea of everybody, turning your phone into a slot machine or blackjack table, that's a conversation that's going to be difficult to have without easy access. So there's that. The legalization of marijuana certainly is going to be back. The leaders, the new speaker and the Senate president and the governor all are in favor of it. But the question is, will Connecticut be one of the few states where this has been handled by legislative action as opposed to by referendum? Because that's really how it's been done in the majority of states that have legalized pot.
Yeah, and Connecticut is not a state that does referendums in the way that Massachusetts or Maine or other places have done this. Vermont, I believe, was the first state to do this actually through a legislative process. And as Matt Ritter told me, this is something he absolutely thinks needs to get done one way or the other. It's just a matter of, will there be the bandwidth to actually tackle this at this point?
And because Connecticut, the only way to do a referendum is to do a constitutional amendment. And unless there is a supermajority, it takes a couple of years to get a question on the ballot. It's got to be done by successive General Assemblies. So that would push it out a few years. Now, you could start that process, and let's say New York goes ahead with legalizing pot. Cuomo is insisted on pushing ahead with it. How will that change the environment? If you have Massachusetts on one side and New York on the other, the sense is eventually it will happen just because other states are doing it. But there's still a reluctance. The governor is definitely in favor of it. He said it's readily available here. He would prefer that it be done in a way that's regulated, that there's some safety, there's some quality, standards, and then, quite frankly, the state of Connecticut gets its cut.
Yeah, I want to get back to a couple of the other issues that we're going to be looking at this legislative session. We do have some more questions coming in about some of the things that we were talking about earlier having to do with vaccinations. Kathy is actually wondering about educators getting vaccinated. She says she's a parent in a public school with special needs kids. She feels strongly that special needs kids need to be at school in person. It's a challenge with this population. I'm wondering, Jenna, as you've been looking through all of and sitting through some of the meetings that they've been having about who gets vaccines when, where are educators on this list, and how much of the conversation has been about the importance of getting especially special needs kids back to school?
Well, at least in the first part of the question, I can answer. The allocation committee met today, and it looks like teachers, educators are going to be in phase 1B. The committee is in favor of that, and the governor has signaled that he's going to follow the recommendations of our state committee here. So I would expect that they would, phase 1B, for anyone who doesn't know, is the next phase that's coming up. It could start as early as January or possibly February.
But of course, what we were talking about before is there's a lot of jostling to get on to phase 1B, but there's still, only so many numbers of vaccines and so many people to vaccinate. Frankly, it doesn't really matter if it's 1A, 1B, 2C, 3PO. I mean, at a certain point, we got to get a certain number of vaccines out to a certain number of people. And right now, as Kasturi said earlier, Connecticut seems to be a little bit ahead of the curve in terms of getting those vaccines out to people.
Yes, I think as of Monday night, the federal data showed that we were one of only 9 states that had vaccinated 2% or more of the population.
Yeah, and that's really important to note. Kasturi, I wanted to come back to you on something else that you've been following here. As we were talking about the various numbers that are coming out from the state and things that legislators might have to grapple with, one of them is hospitals and hospital capacity. Hospitals have been swamped, not just in Connecticut, but around the country, intensive care units, certainly, but just this idea that we don't have enough beds to care for all the people who come in with COVID or anything else. Give us a little sense about what you're seeing in all of these numbers and what we should really be watching for when we start to hear about hospital capacity in the news.
Yeah, I think that the headlines are usually about the number of ICU beds that are occupied, what I would term as being an occupancy rate. I just think that alone that can't tell you very much. I think that the question that you sort of need to be asking is whether or not a hospital has surged its baseline capacity. So hospitals add beds on a regular basis depending on need. Even in non-pandemic times, ICU capacity runs pretty much to the limit because it's sort of wasteful to not be using your ICU units, even in a non-pandemic year. So the sort of another way to think about strain is to think about the number of beds that a hospital has to consistently add over time. When I did this analysis at the end of last month, I think I found about 4 or 5 hospitals that had added beds. Typically, the ICU units can surge by something between 20 to 50%. The hospital that had surged the most was Yale New Haven, and they signaled that they were about halfway to where they were in the spring. But that's just to say that in and of itself, that capacity number isn't terribly meaningful. What you really want to know is how many beds have been added, but the bed isn't the limiting factor, really. It's a staffed bed. So it's the staff that go along with the bed. And that's the really key element here. And that's why vaccinations are so important, because as you vaccinate more of your staff, that's fewer people that need to duck out and quarantine if they've been exposed to the virus, and et cetera, et cetera. So that's why vaccinations are such a key part of the conversation around hospital capacity now, because if we successfully manage to vaccinate our frontline healthcare workers, we won't have to worry so much about staff when it comes to scaling up in the way that we might have to. Like I said, we're not in the clear yet, and the situation's pretty tenuous still.
So Paz, I'll put that to you. The role that hospitals play in the state has periodically over the years come up at the state legislature. Some legislatures and governors have looked at hospitals as good ways to get money. Certainly, a lot of people look at hospitals and hospital systems as places that make an awful lot of money and need to do a lot more for the state. Given everything that Kasturi just said about hospitals being overloaded and the very important role that they're playing on the front lines of COVID-19, do we expect any talk about hospitals during this legislative session?
Well, the governor has sued for peace with the hospital industry. He did resolve the litigation that he inherited from Dan Malloy. Um, I mean, the quick review is, Malloy had cut a deal with the hospitals on how to. I will tax you. It'll help with federal reimbursements, and then we'll kind of split it. We'll cut. There'll be basically a kickback. And
I
then
remember you explaining this on the radio to me once, thinking, I can't actually believe that this is a way that people move money around. But anyway, yes, this is how people move money around. But please continue.
but you could basically increase the tax. It would increase the federal reimbursement, for Medicaid, and then you could basically, rebate the money. It really sounded like a scam that somebody should go to prison for, but it was legal. But the governor held back more of the money, and that became a huge, huge fight. So right now, this administration is on good terms with the hospitals. It's not just that they play an important role in healthcare. They are huge employers, and I don't know how long this can continue the rate of growth, because somebody's going to have to take care of us all and pay for these bills. But Connecticut is one of the, as far as average age, Connecticut is one of the oldest states in the United States. Healthcare generally is good. The coverage, the number of uninsured relative to the rest of the country is low. And medicine is one of the areas that there's growth. There's needs for RNs, there's needs for technicians, sterile processing technicians who make sure that all the complicated surgical equipment is cleaned and reassembled, and it's not just, sticking stuff in the dishwasher. I mean, this is pretty complicated stuff, and there's a lot of potential there to increase the workforce. So yeah, the hospitals are a big player in Connecticut politically because of their economic clout, as well as the role they play in health.
Which then leads us to one of the two last really big things I want to get to. By the way, for all the people asking questions, we are going to talk about early voting and mail-in voting, because I think that that's one of the most important things that the legislature needs to tackle. But Jenna Carlesso, let's talk about health and healthcare, and whether or not there is going to be any movement towards some version of a public option here. It's something that I talked with the incoming House Speaker about. He's very open to it. Ned Lamont, the governor, has not warmed to the idea of the type of public option that I think most people, when they talk about a public option, they mean, right? Like something that's single payer healthcare controlled by the state, maybe paying into some sort of a state healthcare plan. What do you think is on the table for public option and healthcare expansion this legislative session?
Yeah, this year I think you'll probably see some version that looks like, using the state's purchasing power to create negotiate an insurance plan for small businesses that's 50 or fewer employees. I think that's the definition it has been in the past. Nonprofits, et cetera. I do think there'll be movement for folks, some help for folks who are buying insurance through the exchange, perhaps in the form of additional subsidies. How you get there and how that's paid for is a big point of discussion right now.
Yeah. Paz, do you think that there's any political will to make this happen this time around, or some version of this?
There are definitely people in the legislature who want to pursue this, but this stuff is complicated, and one of the the rules of the road in politics is, if you can't explain it in about 15 or 20 seconds, you're in a deep hole. And that's certainly the case with the public option. I'm glad Jenna works first, because this is something that you get deep in, it makes your head spin. But the governor kind of blundered into this in 2019, where he thought that Cigna and some other providers were comfortable with a public option that would be an option. It would be one of many. And he was quickly disabused of that belief that they were comfortable with it. And that's the other factor here. We talk about the role of hospitals as an economic force. Connecticut is an insurance state, and that's always a tension here about what do you owe your hometown industry, one of your hometown industries that employ a lot of people at decent salaries, versus, again, this broader question of how should healthcare be provided in the United States?
Yeah, and can people actually provide the healthcare that is made available to them? Okay, because so many people want to ask, because I want to ask too. What's going to happen with early voting, absentee balloting, or something? I think, as everyone saw, there was a record number of ballots cast in the November election in Connecticut, also around the country. And in large part, that's because Connecticut did something it's never done before, which is it made absentee balloting something you could do. It was relatively easy and painless, and a lot of people took advantage of this. It I think, pointed the way toward a future that looks a lot more like the way a lot of the rest of the world does it, which is early voting, absentee voting. I know a lot of legislators, Paz, think that this is something that needs to happen. Is it going to happen soon?
So a couple things. So Connecticut's constitution, unlike almost every other state, is controlling here. And it's a problem. You cannot just change the law and have absentee ballots available to everybody. This was a unique situation where there is in the Constitution a reference to illness. And Connecticut's statute is more restrictive than the Constitution. It defines it as your illness. It's not just, John, you're concerned about catching the flu. You don't want to stand in line in November, so you're going to vote by absentee. In a lot of other states, you can do that. You got asthma, you're of a certain age, you have certain comorbidities. In Connecticut, there's no way to do that. So what they did was a one-time change for 2020, which said, we're going to take that reference in the Constitution to illness and say, okay, for the purposes of this pandemic, that means if you are concerned about getting sick from COVID, you can get an absentee ballot. And, the world didn't end. Seemed to go well. I mean, there were issues here about mailing out the applications to everybody as opposed to having them apply. I mean, there are some details that they can tweak, but the whole idea of Connecticut having the most restrictive rules on absentee ballots, and I don't think my wife can hear me, so she won't kill me for telling this story, but when my wife was pregnant with our second kid, she ended up giving birth on election day. And under Connecticut's law, there was no legal way for her to get an absentee ballot. But I'm going to tell you, well, she got one because she lied. And that's what happens. You have to have people sort of lie, because unless you're going to be out of town, we have now,
that's exactly the type of voter fraud that President Trump has been telling everybody about, Paz, that I think is very important to bring to light.
Statute of limitations is passed. My wife was in the clear, and that child who was born that day is now a 28-year-old physician.
Yeah, exactly. Right. Well, I'll just say, with a couple minutes we have left. So this is important. It's very complicated to get anything changed in the state. So it's not just as though we can go into session, everyone can agree, this is a bill, we're going to pass it, and now we're going to vote a different way in the state.
Right now, there's going to be a special election in Stamford, end of February, early March, because somebody, resigned. Well, right now, there's no way to do the same absentee ballot rules that we had in 2020 unless they pass a law, and the governor thinks he really can he do an executive order, because the current emergency is going to expire February 9th. So the question is, should there be a permanent change in the law about the question of illness? Shouldn't it be allowed in every election, if you're 75 years old and you're really not comfortable about standing in line to vote? Because right now, unless you have a specific illness, you're not supposed to get an absentee ballot to do that. Now, is somebody going to challenge you? Because really the bottom line is, if you only vote once, the reality is nobody's going to go chase you because maybe you did it by absentee and you weren't supposed to. It is one to a customer.
Kasturi, I saw you nodding your head as somebody who deals with numbers. I mean, you must have been kind of overwhelmed looking at election results coming in from Connecticut and around the country that were just so different than what we'd ever seen before, right? We were seeing record numbers of people taking advantage of the opportunity to vote in a very different way. That said, we also had very long lines of people standing to vote in states that made it a little bit more difficult. But as someone who watches the numbers for a living, that must have been really fascinating to watch.
Yeah, absolutely. I think that I'm still trying to understand exactly which demographics showed up in this election that wouldn't have normally been able to vote or wouldn't have otherwise voted. But yeah, I mean, I think that I agree that I think it's one of the most interesting things that might come out of this session. And it's something that I'm very interested in watching as well.
And Kester, before I let you go, one of the questions that has come in a couple different times from people who are watching, it has to do with freedom of information and it has to do with transparency. I already know what Paz is going to say if I ask him about what the legislature is going to do about this. It's very rare that lawmakers ever pass laws that make it easier for us to get information as opposed to making it harder for people to get information. But I'm wondering how you view a legislative session that is going to be done in a very different way. We're not going to have the same sorts of public hearings. Do you have any concerns as someone who needs to get information in order to tell the stories you tell about the ability to get information in this completely new world in which we're doing government in such a strange way?
I'll be figuring it out just along with everyone else, I think. I don't know that I have another answer for you.
Yeah, that's interesting. And Paz, I guess I should ask you, I mean, do you have concerns about freedom of information? You too, Jenna, about, how things might be hidden from us because we're doing this in such an unusual way?
The internet has changed everything, so you have the counterbalancing interest, which is the right to privacy. And, when the FOI law was passed in the 70s, there was not a concern about reporter going down and getting a copy of a record. There is a concern about somebody, a commercial entity or a newspaper or website, buying a whole database and suddenly putting out all this stuff with, really just to have it out. And there is a concern, there's an understandable concern in this day and age about how much of our lives is out on the web. And I think that's one of the concerns. And I think as a reporter, I want to see the Freedom of Information Act as strong as possible, but I do understand some of the concerns that are out there now because the web has changed everything. There was a time we could see gun permits, but people are terrified that database will be put online and people will know they have a gun. But when I started my career, I could look at those and there were things I could find that showed, business relationships that had been hidden or all kinds of things. So the more you tighten that stuff, the more it does make our jobs more difficult. I can't get, you can't run a license plate. And, I was involved in doing a little expose years ago on some parking ticket fixing, and I could find out who got their tickets fixed because that was public. I couldn't do that story today because that stuff is not available.
Jenna, are you concerned about being able to do your job in this new world, given all the restrictions that we're going to have on access to people?
Yeah, I think there are still a lot of kinks being ironed out. I mean, on the one hand, you see the state trying to put all of the proceedings with the vaccine group, for example, the vaccine advisory group. Even the subcommittees are being broadcast on CTN. On the other hand, sometimes materials that are brought up at the meetings aren't immediately available for the public. If you want to follow along on a PowerPoint or something else, that might show up later. It will show up, but it doesn't show up right away. And if you're trying to be an informed citizen and watch, can be tough to follow along. So there are still areas, I think, that they're working through.
Well, I appreciate all the informed citizens who joined us throughout the course of this hour, asked all these great questions. Obviously, we weren't going to be able to get to all of them. I will say that we've got another event coming up in just a week from today. I'm going to get my calendar out in front of me because I want to make sure I get this right. This is how we do things. I've got 4 or 5 different windows open. It's next Wednesday night, not on a Tuesday night. Next Wednesday night, we've got the second of these events. Other Mirror reporters are going to join us to talk about education, to talk about public services, and to talk about incarceration and criminal justice. So I hope you can join us for that. Keith Faniff is going to join us later on in the month to preview the governor's budget address and what's going to happen with the state budget. So thank you for all of your great questions. And I want to thank our panelists, Jenna Carlesso, who covers health so expertly for the Connecticut Mirror. Thank you, Jenna.
Thanks for having me.
And thanks also to Kasturi Pananjady. And Kasturi, all of your great work, including this COVID tracker, which you can see on the CT Mirror website, ctmirror.org. It really gives you all the latest up-to-date data. So thank you for all your work. Thanks for joining us tonight.
Thank you. And thanks for all of your questions, everyone.
And thanks to Mark Pazniokas, the Capitol Bureau Chief. It'll be an interesting day tomorrow, Paz. Have a lot of fun.
It will be interesting. I'm going to dress differently.
I was going to say, wear your down jacket. I want to thank Kyle Constable, who produces these events for us. Bruce Putterman, who is the publisher of the Mirror. Our executive editor is Beth Hamilton. I want to thank the good folks at the CBIA for sponsoring tonight's event. And I want to thank all of you who are members of the Connecticut Mirror. If you're not yet a member, you can join by going to ctmirror.org and just click on that little donate button. Every dollar helps when you're supporting a nonprofit journalism like the Connecticut Mirror. Make sure to download our podcast, Steady Habits. Some version of this is going to be on our podcast tomorrow morning. And we'll be back and talk to you next week. Thanks so much for joining us, everyone. Good night.